What are the signs of a neglectful parent? Have you ever wondered what signs might indicate a neglectful parent? Neglectful parenting can have serious consequences for a child's growth and emotional health. It involves a consistent failure to meet a child's basic physical, emotional, educational, or medical needs. This lack of care can lead to trauma, which may contribute to symptoms associated with post-traumatic stress disorder, or PTSD. Understanding these signs is crucial for early intervention and support. First, let's look at some behaviors that may indicate a parent is neglectful. One clear sign is indifference. If a parent shows a lack of concern for their child's needs or injuries, this can be troubling. Emotional unavailability is another red flag. A parent who appears apathetic or depressed may struggle to provide the emotional support a child needs. Additionally, irrational or bizarre behavior can interfere with caregiving, making it difficult for the parent to care for their child properly. Substance abuse is also a significant factor. If a parent is under the influence of drugs or alcohol, their ability to care for their child can be severely impaired. Harsh or inconsistent discipline can create an unsafe environment where the child's emotional state is disregarded. Moreover, failing to provide adequate supervision, nutrition, hygiene, medical care, or emotional support can all point to neglect. Now, let's consider how a child's condition might reflect neglect. Signs can include frequent hunger, poor hygiene, or wearing inappropriate clothing for the weather. Unexplained injuries or untreated medical issues are also concerning. A child may display withdrawal, anxiety, depression, or aggressive behaviors. Fearfulness or avoidance of the parent can indicate a troubled relationship. Developmental delays or poor school performance may also arise from neglect. Emotional neglect can lead to specific signs as well. A lack of physical affection, such as hugs or comforting touch, can affect a child's emotional development. Difficulty regulating emotions might result in emotional numbness or outbursts. Trust issues or fear of rejection can hinder a child's ability to form relationships. Symptoms of depression or anxiety may emerge due to unmet emotional needs. From the perspective of PTSD, neglect trauma can disrupt a child's sense of safety and attachment. This disruption can lead to symptoms like emotional numbing, hypervigilance, or trouble trusting others. Children who experience neglect may be at a higher risk for developing PTSD or other trauma-related disorders, especially if neglect occurs alongside other traumatic experiences. It is also important to note that parents with PTSD may unintentionally exhibit neglectful behaviors due to their symptoms. Emotional numbing or irritability can further impact a child's emotional health. Recognizing neglect early is vital. It allows for interventions that can prevent or lessen long-term psychological harm, including PTSD. Treatment and support for both the child and the parent, including trauma-informed care, can improve outcomes. If you suspect neglect, seeking professional help is essential to ensure the child's safety and well-being. In summary, signs of a neglectful parent include failing to provide basic physical and emotional needs, showing indifference or harmful behaviors, and the negative effects on the child's health and development. Identifying these signs is crucial for facilitating appropriate intervention and healing.